Habibi Fahodie and straight black pride, brothers and sisters. This is your brother, DC Radical One, with another radical report. And today we're going to discuss whether or not the Biden administration is headed towards mandatory C-19 vaccines. And that may seem like a weird question because there seemed to be no indication of that. And then a few days ago, Mr. Biden announced door to door outreach, outlined other strategies to boost vaccinations. This is according to the Washington Post. Now, interestingly enough, vaccines, the vaccines have been pushed very heavily, and many people seem to have signed up. And in fact, I think we'll see in this article, as we get into it a little later on, that although over 100 million people have signed up and taken at least one vaccine, the Biden administration says that falls short of their 70% of U.S. adults receiving the vaccine goal that they had set for July 4th. Now, what's interesting about this goal and these deadlines and things like that is, as the administration pushes the vaccine, more and more people are outside, more and more people are interacting, more and more people are traveling, more and more people are returning to work, and more people are returning to their regular lives. And as more and more people are returning to their regular lives, we have not seen a significant rise in cases of C-19. So that elicits the question, why the push for continued outreach and continued vaccination? And also, we have to question, at what point is herd immunity reached? And lastly, now they're talking about another variant and the possibility of yet another shot, in addition to the two shots that over 50% of people have received, and also a push for adolescents and now children to receive the shot, despite evidence stating that the chance of children dying from C-19 is indeed extremely low. So what we're going to do is we're going to actually listen to Mr. Biden himself, and then we're going to look at a little bit of this article, and then we're going to talk about what was said and what we think is going on. So let's listen to Mr. Biden himself.
In today's briefing, we discussed how our administration is going to devote the remainder of the summer to a special focus on 5 ways to make gains in getting those of you who are unvaccinated vaccinated. Because here's the deal. We are continuing to wind down the mass vaccination sites that did so much in the spring to rapidly vaccinate those eager to get their first shot and their second shot, for that matter, if they needed a second. Now we need to go to community by community, neighborhood by neighborhood, and oftentimes door to door, literally knocking on doors, to get help to the remaining people protected from the virus. Look, equity, equality, it remains at the heart of our responsibility of ensuring the communities that are the hardest hit by the virus have the information and the access to get vaccinated. So, as we shift from these centralized mass vaccination sites where we're doing thousands of people a day, we're going to put even more emphasis on getting vaccinated in your community, close to home, conveniently, and a location you're already familiar with. First thing we're going to do, this includes 42,000 local pharmacies where folks with questions can talk to the pharmacists they know and already have dealt with. These locations overwhelmingly allow you to walk in without an appointment, get the vaccination when you're picking up your prescription or just going in to get get toothpaste or something else you need from a drugstore. Second, my team is going to place renewed emphasis on getting the vaccines to more and more family doctors and healthcare providers so more Americans can get this shot at their doctor's office from the folks that they know and they trust the most. Third thing we're going to do, we're going to step up efforts to get vaccines to your family doctors and other doctors who serve younger people so that adolescents ages 12 to 18 can get vaccinated and as they go for back-to-school checkups or getting ready for the physicals they need for fall sports. Fourth, we're also intensifying our efforts to meet people where they are, outside of their neighborhoods, pharmacies, and doctor's offices. This includes continuing to work with employers to make vaccination shots available at work, on the work site if possible, or give their employees paid time off to get vaccinated in a nearby facility. And fifth and finally, we're sending out more mobile clinic units out there to help people at special events, summer festivals, sporting events, as well as places of worship wherever we can find people gathered. In addition to these initiatives to continue to vaccinate the unvaccinated, we're stepping up our preparations to respond to the outbreaks we're going to see among the unvaccinated. For that, we're mobilizing what I'm calling COVID-19 surge response teams. These teams are made up of experts from FEMA, the Federal Emergency Management Agency, CDC, the Center for Disease Control and Prevention, and elsewhere across our government, other groups. And they're going to help states that have particular problems prevent, detect, and respond to the spread of the Delta variant among unvaccinated people in communities with low vaccination rates.
Now, what I find interesting, and there's a lot to unpack here from that video and that announcement by the Biden administration. What I find interesting is the prediction of an outbreak amongst unvaccinated people. Now, the reason I find this interesting is because there's absolutely no scientific way to make this prediction with any validity because none of us can see the future and none of us are soothsayers. And so I really found it weird that Mr. Biden would say that with such certainty. And to be honest, I haven't heard anyone talk about this whole C-19 thing with such certainty since Mr. Fauci made the announcement or prediction that there will be an outbreak sometime during the Trump administration. And he made this prediction in early 2017, I believe January 2017. And I do have that clip, but it is not included in this video. Although, as I think about it, maybe I will include it in this video in post-production. But with that being said, another thing I found interesting is that their goal, or their strategy, I should say, excuse me, is to take and present the vaccine through people and professionals that they think people already trust. Your local pharmacist, your healthcare provider. And then if that doesn't work, they're going to bring a truck and bring it directly to your neighborhood and walk up to you and I guess provide you with information that they think you don't already know. I mean, in the digital era, in the information age, most people who aren't vaccinated because they do not want to be vaccinated. This is safe to assume because of the mass outreach and the mass vaccination that has already taken place. So why does Mr. Biden and his administration feel that it's necessary to go door to door to encourage people to be vaccinated when over 50% of Americans and probably over 60% of Americans have already taken at least one shot? What is really behind this push for mass vaccination at a time where everything is opening up and there's been no sign of any major uptick in new C-19 cases. In addition to this, there's a lot of discussion about this new Delta variant. And then the Delta variant is as bad as they say it is. And the people who already have the shot are not protected against the Delta variant. How does that make people who are unvaccinated want to get vaccinated when the people who are vaccinated aren't protected against the new variant that's supposed to be even worse than the original? These are all questions that we have to ask ourselves, and someone should ask the Biden administration, but I don't think anyone will. So, brothers and sisters, we'll just have to wait and see how this whole thing turns out. And of course, the next step beyond, of course, door-to-door outreach, there's only one step further than that, and that's mandatory vaccination. And my question is that, are you going door to door? If you're going door to door, are you going door to door because you know who already isn't vaccinated? Or are you just targeting certain communities? Because one of the things that Mr. Biden was talking about was equity and equality. And I find that interesting because when we talk about economics, when we're talking about police murder of Black people, when we talk about the things that Black people really care about, there is no program, there is no strategy, effective strategy for any type of equity or equality for Black people. But in this one instance, when it comes to this vaccine or these vaccines, suddenly equality in underserved communities is the most important thing in the world. Let Mr. Biden tell it. I, for one, find that very, very, very interesting. And it should give our people plenty to think about. So, brothers and sisters, I guess later on this summer, you'll have to be on the lookout for the vaccine truck and the door-to-door vaccine information givers. I don't know what else to call them. And I'm sure they'll be greeted the way most people who knock on your door who you don't know are greeted. I hope the people that they're paying to do this make a lot of money, because going into the wrong neighborhoods at the wrong time can be very risky in many places in America. Good luck to those people with those jobs. So with that, brothers and sisters, I'll bring this to a close. And I say Abibi Faodie and straight Black pride. Thank you for watching this video. Don't forget to like, share, and subscribe. Also follow us on our other social media platforms. On Instagram, we're at dc.radical1. On Twitter, we're at dc_radical_one. And the Cash App is $DC Radical, the numeral 1. Thank you again.